Next, I'd like to move on to a topic that's very near and dear to my heart, as I'm the first author, and Dr. West graciously allowed me to present this. This is Erlotinib for early-stage EGFR mutant non-small cell lung cancer. And this is a clinical trial that was conducted at multiple sites, all of whom have been testing for EGFR mutations in tumors from patients who have been surgically resected. So as opposed to what we've been talking about almost exclusively so far, stage 4 non-small cell lung cancer, this trial is for patients with earlier stage EGFR mutation-positive disease. And we modeled this after the RADIANT trial, which is an ongoing 1,000-patient trial of Erlotinib versus placebo after routine care for early-stage lung cancer, not selecting for EGFR mutations. But this trial required EGFR mutant-positive disease. Patients received routine adjuvant chemotherapy and, if indicated, routine radiation therapy and had to have no known disease at the time of enrollment. They received Erlotinib at the standard dosing, 150 milligrams daily for 2 years total, which is the same duration as RADIANT, and are getting CT scans every 6 months for 3 years, then annually thereafter. I'm reporting here the initial 36 patients on the trial, but subsequently we've expanded this trial to 100 patients total. This is a slide of treatment length and duration for patients. The majority of patients, with each bar representing the treatment of one patient, the majority of patients made it to 2 total years of treatment. And a few patients came off for various reasons, including side effects and toxicity, with a group up front, a group in the middle around a year, and a group toward the end. The color change, green represents 150 milligrams, yellow represents a dose reduction to 100 milligrams, and red represents a dose reduction to 50 milligrams. So many patients were dose reduced to make it more tolerable for the duration of 2 years, but most patients did get through 2 years of treatment. I'm going to present 2 efficacy slides here that are all preliminary. This is the disease-free survival, where we can see that the primary endpoint of this trial for the first 36 patients, as it was originally conceived, was 94%, which beat what we expected to see in historical controls of 70% for this patient population, and beat the threshold of 86% that we hope to see. The median duration of follow-up is somewhat short for an adjuvant trial so far, at only 2.5 years. And one thing of note is that after about 2 years, we do start to see recurrences. And there are some patients who are censored and continuing on trial here. Overall survival, only 2 patients have died so far on treatment, and many patients continue to carry on after finishing Erlotinib. Of those patients who recurred, 1 patient progressed while receiving the adjuvant Erlotinib. Most of them recurred after receiving the adjuvant Erlotinib. We repeat biopsied many of them, and most did not have a resistance mechanism such as T790M. 5 patients were subsequently treated with Erlotinib after having adjuvant Erlotinib in the then metastatic or incurable setting, and of the 5 patients that were evaluable, they all responded. My conclusion is that it looks like treatment with adjuvant Erlotinib is feasible, but patients need dose reductions, that the primary endpoint of this trial was met. This suggests altogether that adjuvant Erlotinib may have, at the very least, a cytostatic effect and delay the development of micrometastatic disease. So 2 years may not actually be long enough. And based on these promising data, the trial has now enrolled 100 patients, and final results should be available in a few years.
Thanks for listening. If you like and learn from our GraceCasts, you can subscribe on iTunes by just searching for the term Cancer Grace, find podcasts in the subject you want, pick a format of audio or video, and then just click subscribe. It's that easy. And for those of you who don't want to miss any of our programs, there's even a feed for all subjects. You can also find us on YouTube at Grace for Cancer Info, and that's the number 4 in one word, Grace for Cancer Info. Finally, if you haven't been there yet, please check out our Grace website at www.cancergrace.org. And don't forget that donate button in the upper right. Our content, which helps tens of thousands of cancer patients around the world every month, is made possible by your support. Thanks again.